UN Secretary-General Ban Ki-moon on Friday called on the world to extend support and compassion to persons living with autism, as it is the only way they can create a better world for everyone to live in. Autism has grown from being a rare health issue to being a major international concern, as estimates state that more children will be diagnosed with autism this year than AIDS, diabetes and cancer combined. Addressing participants at UN headquarters on World Autism Awareness Day, the UN chief stressed that while interventions are being sought to combat the disease, the world should not discriminate against people living with autism, as the disease itself strikes without discrimination.
We have to unite our efforts. We have to share experiences, what works and what do not work. And we have to raise funds to turn workable solutions into practical actions. That difference between blame and support, between judgment and compassion, is what World Autism Awareness Day is all about. Our challenge is to move people from misunderstanding to empathy.
Panelists admit that autism has become such an international concern that there is urgent need for global unification to find the best ways of reducing its effects on the world's people. Ambassador Abdul Kalam Abdul Mumin of Bangladesh at the United Nations spoke on the need for international cooperation to support one another and help people with autism live the best life possible. He outlined some of the best practices his country is adopting to tackle the effects of the disease.
To address the issue of autism, the government has taken a number of initiatives, such as one, its Ministry of Social Welfare introduced Disability-Related Coordinated Special Education Regulation 2009 that includes learning procedures of autistic children. 2, initiating Society of Welfare of Autistic Children. 3, paying 100% salaries and allowances to the teachers of autistic children. 4, autistic medical services have been extended significantly at the Sheikh Fajilutun Nessa Specialized Hospital, and the most prominent being the setting up of the Center for Neurodevelopment and Autism in Children at the Bangabandhu Sheikh Mujib Medical University.
On his part, Ambassador Frederick Barton, the U.S. Ambassador to the United Nations Economic and Social Council, lauded the U.S. government's willingness to support autism research. He emphasized that it has become a #1 health puzzle the American government is working to address.
At our National Institutes of Health, research is expanding to address every aspect of autism, from testing innovative treatments to searching for the genes and environmental factors that contribute to the disorder. Early diagnosis and intervention is enabling families, doctors, and child care providers to seek and receive assistance. The Centers for Disease Control and Prevention's monitoring and research programs closely track the prevalence of autism in communities across the nation, allowing us to better understand who is affected by this disorder and what causes it.
Such interventions are being adapted by governments globally, as developing countries like Ghana is encouraging private sector support for reducing children with autism. Here, government social interventions in the area of employment, education and training of persons with disabilities have also been encapsulated in the National Disability Act, currently under debate in the Parliament of Ghana. It is hoped that with these worldwide movement in addressing autism, people living with the condition will be able to live better lives throughout the world.